Hello, my name is Evie Sands. I am a director with Inpatient Rehabilitation Services at the University of Minnesota Medical Center, Fairview. I would like to thank Dr. Edward Chang with University of Minnesota Physicians specializing in orthopedic oncology and adult reconstruction surgery for his vision and commitment to providing our patients with information and support. I would also like to thank the Wyckoff family and the Karen Wyckoff Rein in Sarcoma Fund for their generous financial support of this video. Our hope is that by hearing each person's story and sharing a bit of their journey through the stages of recovery, you will have a better understanding of what to expect following major limb reconstruction surgery. While each person's journey is different, you will understand how this surgery may impact you and the possibilities that exist to continue with activities of daily life that are important to you. I would now like to introduce our moderator, Dr. Bill Robiner, Director of Health Psychology with the Department of Medicine.
It's really a pleasure for me to be here, and I'm looking forward to meeting all of you as we do this. We've not met before, and I think that we've already been enjoying getting to know each other thus far, and it will be nice to get to know each other during this afternoon. So,
okay.
Steve?
Well, my name is Steve Simons, and I'm 25 years old. And when I was 21 years old, I was diagnosed with high-grade osteosarcoma in my left distal femur. The tumor was 4.3 inches long, so it was a big tumor throughout my entire bone. I was faced with chemo, the thought of going through chemo, and I was also told immediately that I would never walk again without crutches. So for a 21-year-old, that was pretty hard to take. I was put into what they call traction in April of 2005, and that's when they put a pin through your lower leg and they pull your bones apart with weight so that the bones can heal together. I was in traction for 2 months, and then they put me in what's called a spike cast, which is kind of a half body cast. It went from my stomach down and then through my broken leg. And I was in that until August, when I had my amputation, August of 2005. I am above the knee. In February of 2006, I finished chemo treatments, went back, started to live my normal life. But in February, I also fell and broke my hip, so I wasn't able to start walking on the prosthetic that I'm wearing today, which is a C-leg. 12 months later or so, in May of 2007, I was able to start walking on my prosthetic, and I've had a little over 2 years of getting my life back to normal, and I'd say it's pretty fantastic.
Well, welcome, Steve.
And I'm Ruth Bachman. I am a 60-year-old wife, mother, grandmother, and left transradial amputee. And about 6 years ago, I was a 54-year-old woman, wife, mother, and grandmother, and left-handed woman. And I had a soft, non-painful lump on the inside of my left wrist that I ignored for about 7 weeks, hoping that it would go away. And an MRI revealed a 6-inch mass beginning in my hand, filling my wrist and extending into my forearm. Dr. Dennis Closey here at the University of Minnesota did a biopsy and gave me my diagnosis of malignant fibrous histiocytoma, the most common form of soft tissue sarcoma, and my prognosis was good, 40 to 60% survival, with a treatment package that included 2 rounds of chemotherapy and radical surgery. And so I had that time during chemotherapy to get used to the fact that I was going to have to be right-handed, which was interesting because I had something to focus on. And then my surgery was performed on Friday, the 13th of June in 2003, and they discovered that the chemotherapy had no effect on the tumor at all. And so the good news, bad news in that was that I didn't have to have chemo post-surgery, so that I was able to resume life. But then if any of the cancer cells had decided to move on, they were also unaffected by the chemotherapy. But I am 6 years out and living life to the fullest at this point.
And I'm Steve Grosclose, and I've known Ruth for a while. I used to be president of an amputee support group locally, and I met her as her peer counselor. I lost my right hand also to a soft cell cancer, a synovial cell sarcoma. I had a little soft bump in the palm of my hand that I noticed around Labor Day weekend, and got it checked a couple weeks later, and had it checked here at the university, and a few weeks later we were amputating my hand as the best form of solution to eliminate the cancer. We did not do any chemo. There was no medical evidence that chemo helps that particular type of cancer in my circumstance at that time. And I'm 11 and a half years out now and moving on to a normal life again, and I'm a father of 2 daughters, and you know, life is good and life keeps going, so I just learned how to adapt to it.
So it sounds like you've each been through, you know, quite an unexpected event in your life, and I'm sure initially when you first heard the news, it gave you just all kinds of emotions and thoughts. And do you remember back to those days what that was first like, and then what the process that you went through started to be?
Initially it's terrifying and scary and every bad word like that you can think of, and through supportive family, friends, and medical staff, you face the issue and you do what you have to do, and I've learned how to deal with it and go on from there.
Steve, at that moment, did you ever imagine your life would be going as well as it's going today?
No.
That was
at that moment, you mentioned your percentage of survival rate. I was told mine was a little bit worse than hers. Mine was more like 80-20, and the 80 was the bad side of the curve. And I didn't really think I'd be around 5 years. So I'm 11 years plus now, and glad to be here and glad to participate in something like this. And it doesn't matter what kind of cancer you have, you have to deal with it and keep going, and you have to believe in yourself and your medical staff.